Welcome, everyone. We are very excited to bring you today's webinar, where Dr. Michael Kaminer will be introducing Cutera's Enlighten system, a new high-powered dual-wavelength picosecond plus nanosecond platform for the treatment of tattoos and benign pigmented lesions. My name is Greg Nagy, and I will be your host for the session. We are very happy to have you join us today. Before we start, a few housekeeping items. Please be aware that all participants' lines will be muted to avoid any background noise. If you have any questions, please use the chat feature. It is located on the lower right side of your screen. Just type your question into the white box, then press the Enter key on your keyboard. Questions will be answered at the conclusion of the presentation portion of the webinar. This webinar will be recorded, and a link will be sent to all participants shortly after it has concluded. We are thrilled that today's session will be presented by Dr. Michael Kaminer. Dr. Kaminer is a recognized world leader in dermatology and cosmetic surgery. He is an associate clinical professor of dermatology at Yale Medical School and an assistant professor of dermatology at both Brown and Dartmouth Medical Schools. Dr. Kaminer, welcome, and on behalf of the Cutera team, thank you for joining us to present Enlighten. Dr. Kaminer, please take it away.
Greg, thanks so much. I really appreciate the kind words and the nice introduction. And I appreciate everybody who's taken the time today to come and spend hopefully what will be a productive few minutes where I can show you some information. Hopefully you'll feel that it's mostly data-driven, where we can talk a little bit about the science behind tattoo treatments, and in particular where Enlighten has some attributes that at least I think are worth looking at and worth considering. So I'm going to go through things, and at the end, we're going to try and leave plenty of time for questions so that we can make sure we've covered everything, and we're going to try and wrap everything up within an hour. So here's my one disclosure relevant to this presentation, which is pretty clear-cut. But for those of you who know me, you'll know that what I'm going to present is science-driven, and when it's my opinion, I will try my best to tell you that, so it's clear the difference between science and sort of my thoughts on things. And if I don't do that and anybody has any questions, please feel free to ask me to clarify at the end. So basically the whole concept of why we're here is many of us treat tattoos, and the world of tattoos is changing in multiple ways, and we're going to talk about, I think, many of them, if not all of them. Importantly, it's changing on the technology side, and this is driven in part by the demand that those of us who treat tattoos have placed on the companies, where we've said, look, we're treating tattoos, we're doing okay, and I'm going to show you some information in a minute, but it's taken us a lot of treatments and the tattoos aren't always clearing. So what can you do for me? What have you got lately? And a lot of times we ask industry to do things for us and they sort of look at us and say, sorry, we can't. But in this case, I think the company has done something that's quite interesting. So the Enlighten device has some very nice features that are sort of potentially some game changers. So for example, there's a dual wavelength in that there's a 1064 and 532 nanometer component. And in addition, there's two selectable pulse durations, which we'll talk about in some details, both a picosecond and a nanosecond. There's a lot of pulse energy, or basically the way I like to think about it, there's a lot of horsepower in this device that allows you to take advantage of it, and we'll talk about that too. And then importantly, there are a range of spot sizes with therapeutic fluences at all spot sizes. And I'm going to try and show you why I think this can be something that's at least worth thinking about as you treat tattoos. So the indications in terms of both the CE mark and the FDA clearance are for tattoo removals in all skin types and all colors of inks, not limited to any one color. And you can read the specifics there. And it's also cleared for the treatment of benign pigmented lesions, both epidermal and dermal, in all skin types. So the interesting part about tattoos is when you look at the world of tattoos, so I just spoke a minute ago about the world of tattoos in terms of how we treat it. There's the other world of tattoos, which is that people are getting them at a pretty aggressive rate. Tattoos are relatively prevalent both in the UK, and these are the data that we have, UK and the US. 29% of sort of young adults in the UK have a tattoo, and 38%, 32%, somewhere in there in that same age range in the US. So maybe a slightly higher prevalence in the U.S., although the statistics may be a little different between the two. But the tattoo removal demand is pretty significant. There's been a significant rise in demand, almost identical in the U.S. and U.K. of 32%, with expectations that the demand for tattoo removal is going to go up 19% a year. Because remember, we have this generation of post-baby boomers, and there's a lot of them, and now they're getting tattoos for a variety of reasons. But since there's so many, they're going to want to get rid of them. So why do people get rid of tattoos? There's a lot of different reasons. The name on the tattoo is a very common one, and I just wonder why people who get tattoos don't think of this in advance, but often they don't. Employment stigma is a big reason why I see patients for tattoo removal. I'm seeing one woman now who wants to be a state police officer and is unable to because she has a tattoo on the back of her neck, and she is now, in the absence of some of these more advanced technologies, into her 12th treatment, and she's had to delay her career for several years until the tattoo is removed enough that she can go ahead and meet the requirements of the police force. So I see this one a lot, and then change of heart or tattoo regret is another big one, and there are many others, which I'm sure many of you have seen. But the reason for this conversation, and the reason why the company, Cutera, has spent so much time developing the technology, is in part because of this slide. And basically what it is that if you look at, and it's a complicated slide, but the y-axis is the percent of patients achieving complete clearance, and the number of treatment sessions is on the x-axis. For black, only 58% of patients at 10 treatments will achieve complete clearance. When they have black and red, that number drops a little bit. And for all other colors, it drops tremendously down to 10, 12%. So we do okay for about half of our patients in 10 treatments, but that means that half of our patients don't do as well, and it requires a lot more treatments, and that's only if they have black and red. Any other colors, and the patients are toast. So clearly we can do better. We can improve the percentage of patients who get complete clearance, and we can do it faster, and we can do it for more colors. And so the question is, how do you do that? Well, let's talk about that. So when you look at tattoo removal, basically up until maybe even today, before seeing some of these slides, we all thought, okay, you take your laser and you point it at the tattoo, you fire and you pray. And what you're praying is that the physicists who designed the laser had thrown a blanket over all the tattoo inks that you're going to see. But the reality of it is they haven't, because they couldn't. And what Cutera is trying to do with the Enlighten is throw a broader net. So there are lots of reasons why, or lots of characteristics of ink particles that tie into why they will not respond. So, and it's important to start to think about these. You don't have to master this in the next 10 minutes, but it's important to start to think about it because it'll help you start to understand the logic behind the laser, and then maybe how to use it if you decide to own one. So there's a variation in depth. When somebody's placing tattoo ink, they can place it superficially or deep. A more advanced or skilled tattoo artist will likely be able to place the ink deeper, and more amateur tattoo artist more superficially. Deep ink requires more energy at more depth to reach, so you can imagine it's harder to get to. Similarly with particle size in ink. Ink is not all one particle size, and you can have a variety of particle sizes of ink, and I'm going to show you some more information in a minute. And in addition, this ink, no matter what color, can then conglomerate into larger sort of super ink particles, which are even larger than that. And then clearly we have a diversity of ink colors that are available for tattoo artists as well. So you've got depth, particle size, aggregation or conglomerates of particles, ink colors. And when you look at sort of how you're going to treat these things, depth becomes important. Excuse me. And depth becomes important because, as I mentioned, some of the more sophisticated tattoo artists can place tattoo ink deeper. And as you look at this slide, if you look at the electromagnetic spectrum across the top, you'll see as the wavelength gets longer, and we've known this from other lasers for decades, as the wavelength gets longer, the depth of penetration is able to increase. And so if you go to 1064 nanometers, you have a potential theoretical advantage that it will penetrate more deeply than shorter wavelengths. Again, helping to reach the deeper particles. And then the next question becomes, all right, so you got a wavelength. What else can you do to go deeper? Well, spot size starts to tie into depth. So if you have a small spot size of, let's say, 2 millimeters, we know that with lasers and the way they work and their physics, you can only go to a shallow depth. And in this cartoon illustration, to some extent, somewhere epidermal. But if you want to go deeper, so in addition to choosing a longer wavelength, you can choose a larger spot size, and you can get up to 3 times greater depth of penetration going from a 2 to 8 millimeter spot size. So again, we're starting to say, okay, how can we use our technology to get to depth And the reason why is the tattoo artists are forcing us to go there with the way they place the ink. And so then the next component of that is, okay, so you've got a wavelength with a big spot size. So what? If it's weak, like a little pea shooter or a water gun, and you can't get energy at depth, then it doesn't matter how deep you can get because the ink particles are just going to thumb your nose at you. But if you have a lot of power at a long wavelength that can go to a significant depth using a larger spot size, now all of a sudden you've got something because you can deliver peak power, high energy at depth, and the ink particles will be impacted. And so you start to think about, okay, now conceptually we can go deep at high energies, but it's not all about depth and wavelength to some extent. We'll talk about that in a minute. But now you've got this study that was done by Cutera where they looked at black ink, and it's a specific sample, black 8001. And on the bottom, on the x-axis is size, and on the y-axis is the number of particles or percent of the volume of the tattoo ink. And what you can see is this is a biphasic graph. And all that this means is that even though this is one ink sample, black 8001, it has two different sized ink particles. And the range in size goes from 0.1 to 1.5 microns. And what that gets to is, they're probably different individual ink particles out of that size, but you have these conglomerates or aggregates of ink. And so now you start to think, okay, how can I do small particles as well as large particles? And this gets into the concept of having two different pulse durations. So one of the interesting features of Enlighten is it comes with two specific pulse durations, a picosecond pulse duration of 750 picoseconds and a nanosecond pulse duration of 2 nanoseconds. Now, the 2 nanosecond pulse is a little bit shorter, and I'll show you some data on this in a minute, than traditional nanosecond lasers, which may have some advantages. And then, obviously, the picosecond is relatively new to the industry in terms of having lasers that can do this. But it turns out that there's some interesting data that starts to suggest, if you look at things based on thermal relaxation time and particle size, that larger ink conglomerates or ink particles can be treated with a nanosecond wavelength. So ink conglomerates, larger particles, nanoseconds might have some advantage, whereas picoseconds, or the smaller, shorter wavelengths, may have an advantage on these smaller particle sizes. So again, based on the work that Cutera did looking at the particles for the black 8001 ink, we have both large and small ink particles, and you can tune the laser, in particular the Enlighten laser, with nanosecond and picosecond. And for those of you who already have nanosecond lasers, you can do the nanosecond part, but the picosecond part is something that would be something to be able to add to your arsenal. And so if you look at a tattoo like this one, which is all black, but you can see there are certain parts of the tattoo that have more ink. They're a little bit darker. And there are certain parts of the tattoo which are lighter, a little more faded, sort of softer black. You start to ask yourself, okay, with a current nanosecond laser, I would just treat this whole thing as one tattoo and see where I got more benefit or less, and maybe go back later and treat some areas a second, third, fourth, more times, or even more. But here with the two different pulse durations, you have the opportunity with the nanosecond to go and treat the darker, densely packed ink areas, or whether the thicker ink, with nanosecond. And you can, in theory, take this device and use the picosecond pulse duration to treat lower density, lighter areas, and you can sort of titrate or fine-tune the laser to then go after laser to tattoo ink based on maybe some properties that we can't do currently with existing technology. And here's just a little bit of pointing out what I mean by those different colors. So on the left-hand side of this graph, there's two graphs on the same page. On the left, it just shows a frequency or prevalence of tattoo ink in tattoos that are placed, and I believe this is in the United States. So 96% of them are black or dark blue. The overwhelming majority are going to be in that color range. That means 96% of tattoos have black, 23% have red, 19% green, and along the lines, blue being the least prevalent of all colors in tattoos. And then the graph on the right starts to show how these different colors absorb light or absorb electromagnetic energy at a specific wavelength. And you can see the Enlighten specifically is 532 nanometers and 1064 nanometers. and there's at least somewhat of a peak at red and orange. There's a little bit of an absorption of blue, maybe a little bit less of green. And if you go out to the 1064 nanometer, a little bit less of blue and green. But in the next slide, I'm going to show you, we're going to talk about black. But what this is designed to show is that it's mostly black, but there are other colors. And at 532 nanometers, you do have a reasonable amount of absorption in the other colors that we see, some better, some worse, but it's a nice wavelength for starting to throw a broad net over colors other than black and dark blue. All right. So this next one shows black ink. So there's two lines on this graph. The top graph, which is 96% of tattoos, is black ink and its absorption. So black ink is absorbed all across the electromagnetic spectrum at both 755 and 1064. I apologize for that phone ringing in the background. Hopefully that'll end soon. Melanin is a little bit different. Melanin is absorbs better, 755 nanometers, much better than 1064. And there's a 3 times lower absorption by melanin at 1064, which means that darker skinned individuals can be safely treated using a 1064 nanometer tattoo when you're trying to get to black ink. But when you look at 755, and we have nanosecond lasers that we've had for years at 755, it's very hard to treat black ink in dark skin because the melanin is competing for that energy and it creates side effects. When you go to 1064, it really makes it a much safer and a much better way to start to treat black ink when you get into dark skin types. So this was a study that was done. It was an IRB study, approved study, to evaluate the safety and efficacy comparing the Enlighten laser, which again has nanosecond and picosecond pulse durations, with a traditional Q-switch nanosecond laser. 42 patients, 41 completed the study, 2 to 3 treatments, 6 weeks apart. And what's interesting here, so in the left panel, that's the Enlighten treated side. The right panel is the traditional Q-switch nanosecond. So the Enlighten is a 2 nanosecond device in addition to the picosecond component. So you can choose pico or nano. If you choose 2 nanoseconds with the Enlighten, and you compare that to a 6 nanosecond traditional Q-switch device, there's a statistically significant improvement in the 2 nanosecond Enlighten side as compared to the 6 nanosecond traditional Q-switch laser. So it shows that not only do you have access to picosecond technology in this laser, but the shorter pulse duration 2 nanosecond shows a statistical enhancement in the ability to clear tattoos using sort of readily available nanosecond technology just by shortening the pulse duration to 2 nanoseconds. In a different study where the same tattoo was treated, part of it with the 6 nanosecond traditional device and the other half of it with the Enlighten 2 nanosecond device, 61% of the patients that were treated in the study showed more clearing with the Enlighten 6, I'm sorry, now I'm getting myself saying all these numbers, I'll say it again. 61% of the patients in the study showed more clearance with the Enlighten 2 nanosecond pulse duration, 6 weeks following 2 to 3 treatments, as compared to the patients who were treated with the traditional 6 nanosecond Q-switch device. So essentially, this 2 nanosecond Enlighten seems to have more efficacy on black tattoos than traditionally available nanosecond technology. All right, and just some images. You compare this one, the right-hand image, the left side was the traditional Q-switch nanosecond technology, and on the right was the shorter 2 nanosecond Enlighten. So we haven't even talked about picosecond technology or its use for Enlighten yet. Again, that's that same slide, and I'll show you here. The left is the before, the right, this tattoo is split into 2 halves. On the left-hand side, you can see that the Enlighten at 2 nanoseconds created more improvement after 3 treatments than the traditional Q-switch laser on the right. Now, there's a different cohort that was, different study that was done where there were 3 different cohorts, and I'll try and walk us through this so that it all makes sense. Cohort number 1 was the Enlighten picosecond laser, and it's 750 picoseconds, versus that same traditional Q-switch laser that I showed you a minute ago that is at 6 nanoseconds. Cohort number 2 tried to take advantage of the full power of Enlighten by doing both 2 nanoseconds and 750 picosecond treatments compared to the straightforward 6 nanosecond technology. And cohort number 3 was basically what I just showed you, the 2 nanosecond technology of the Enlighten versus the 6 nanosecond traditional Q-switch laser. So in cohort number 1, if you look at these pictures, it's pretty impressive. I mean, the difference when treated with the picosecond technology on the left, which is the Enlighten, versus the traditional 6 nanosecond Q-switch laser on the right, you can see that there's a significant improvement. And again, this is one individual tattoo, but this was repeated in some of the data that was used in the study. But you can see that there's a nice improvement here. And interestingly, even in some of the conglomerates as well. So the picosecond component can do a lot of improvement on all parts, and it may be better on the lighter ink. This is the second cohort where both nanosecond and picosecond were used. And so what you can see is the baseline on the left. Then the second panel, the tattoo is split in half. On the left side of the tattoo in the second panel, and I'm going to try and show you what I mean. I'm going to make sure everybody's on the same page here. So here's our second panel. Just made a little purple mark here. On the left side of that panel, that was treated with nanosecond technology with the Enlighten, and the right side was treated with the traditional Q-switch. Then 6 weeks after a second treatment, and the second treatment is this box I'm going to check now, all right, so that's that panel. The second treatment was picosecond treatment on top of the previous done nanosecond, and then another treatment was done at picosecond. So in this last box over here, this left side of the box is the tattoo that's been treated with both 1 nanosecond treatment and 2 picosecond treatments, and this right side of the box over here, see if my R can draw, that is just 6 nanosecond treatment. And you can see that the left side looks to have better clearing with both the black ink and as well a little bit of the red ink, especially towards the lower part of the butterfly. The take-home lesson from this, I believe, is that if you use the nanosecond and the picosecond together, you can start to get a little bit of an enhancement in treatment as compared to just traditional Q-switch 6 nanosecond technology, which is on the right-hand side. Importantly, the red was not treated in this, but you can even see, I mean, because you're going to get some bleeding when you try and treat the black, you can even see that some of the red seems to have gotten better. All right, and this is just a straight nanosecond comparison. On the top here, this is the traditional Q-switch laser, which I've talked about now several times, and you compare that to the shorter pulse duration Enlighten nanosecond treatment, and you can see that the 2 nanosecond here on the bottom seems to have done a little bit better in terms of clearing than the 6 nanosecond here on the top. And if you look at some of the data from the study, which you can see across here, and I'll leave the slide up for a second so you can try and just look at it. If you look at grading in terms of improvement on a 0 to 4 scale, whether you take any of the 3 cohorts, cohort number 1, which is picosecond only, cohort number 2, combination of nanosecond and picosecond, cohort number 3, just comparing the nanosecond technology. In all 3 cohorts, the Enlighten created statistically significant improvement as compared to a 6 nanosecond Q-switch laser when you look at the global improvement in these tattoos. So what's nice is that no matter how you use the Enlighten, nanosecond, picosecond are together, there's some data here that suggests that you're going to be able to get improved clearing as compared to technology that we've had in our office for several years now. So the study summary of that component is just that the Enlighten, and hopefully the slides made it pretty clear, is efficacious and safe for tattoo removal on all skin types, and specifically resulted in more clearance than the reference group, which is the traditional 6 nanosecond Q-switch laser. And in this study, there are no serious or unexpected adverse events were observed throughout the course of the study. And so I think a big picture of what we're starting to learn is that particle size, particle color, particle depth all have an important role in determining how an ink particle is going to respond to the laser that you shine on that skin. And so having longer pulse durations in the 2 nanosecond range seems to work well on darker skin, on larger particles, the shorter pulse duration perhaps on the smaller particles. And again, you would want to choose your wavelength to match the color and the pulse duration to match the particle size, and then spot size, don't forget spot size because that's a key component to try and increase your chances of getting to depth. So we wanted to show you just a couple of slides here of a patient that I treated using the Enlighten. And here what you see on the left-hand side is her picture before treatment, but this is after anesthesia. So we put a little 1% lidocaine with epinephrine in. and that's the white blanch that you can see around the tattoo. But we divided this tattoo in half. So on the left side of the tattoo, we use the nanosecond technology. So what you can see is we use 4.5 joules with a 4 millimeter spot size at 2 nanoseconds. On the right side, we tried to match those settings exactly. So we use 4.5 joules, 4 nanoseconds, but we use the 750 picosecond pulse duration. What's nice about this device is you can go back and forth between picosecond and nanosecond almost instantaneously. It's really fast. It's easy to go back and forth. It's easy to change spot sizes. It's just a nice, elegant, I think, well-designed device. You can see on here the number 3.8 in 2 spots. That's because with the picosecond technology in these darker areas, and the darker area was sort of through here and the other one, with this picosecond pulse duration, the skin really started to show a lot of laser energy absorption. So we turned it down to 3.8 joules in those areas where the ink was darker. And here what you see, so the slide on the left is one that I showed you already. That's with the markings of what we used. And the slide on the right is this same patient 8 weeks later. And again, it's black ink on the lower back. She had been treated with other lasers previously, which is why there was a little bit of fading of the tattoo beforehand. But we had hit a wall, and she wasn't getting any better. So this is on the left side, you can see, and you can draw your own conclusions, but if you see this patient live, what it appears is that her left side, which was the nanosecond side, seemed to clear a little bit more with one treatment than the picosecond side. And it probably has a little bit to do with the depth of her ink as well as particle size. But she cleared much more in this treatment than she had with several other different treatments with other lasers. And I think it was a nice example of the power of the Enlighten device. And so it's important to note, because it's not just a one-trick pony, that the Enlighten is also cleared for treatment of benign pigmented lesions. This slide is just a representative example of what those might look like. But it has a lot of different applications with the dual wavelength, so you can treat light skin, dark skin with 532 and 1064. And you can choose your pulse duration, you can choose your energy and spot size, and safely and I think nicely effectively, although we haven't had the Enlighten long enough to do a lot of work with this. It's really an interesting option for treating benign lesions, pigmented lesions, as well as tattoo ink. So here's some examples of the benign pigmented lesions and sort of what you can do with that. I believe these are all at 532 nanometers with the picosecond, 750 picosecond pulse duration. But you can see really nice clearing. Again, same thing. I'm sorry, this was 1064 nanometers. So you can use picosecond, 1064, 532. It's easy to go back and forth. But again, you can see nice clearing here. And so the bottom line is that the device has some flexibility. We've been asking questions about tattoos for many years in terms of how can we treat them better. I think what's nice is we're starting, A, from technology, and B, from some of the work that Cutera has done to understand a little bit better what makes tattoo ink tick. And because of that, having 2 different pulse durations, a variety of different spot sizes, and at higher energies, and 2 different wavelengths, but having that at high energy with a wide range of fluences allows us to sort of custom tune this device in ways that maybe we couldn't do before, when all we had was a Q-switch nanosecond laser that really just had one wavelength, and that was all you had. So I think we can treat multiple tattoo colors. In fact, I'm pretty comfortable that now we can. We can do it more effectively with some of the different parameters in the Enlighten. We can treat the benign pigmented lesions. It's safe for all skin types. And like I mentioned earlier, it's a nice device that I think is relatively easy to use. The user interface is very easy, and I think you'd find it something that in your practice was something that you could easily get comfortable using, which is the way I was able to find it in our office as well. So with that, I will stop talking about the slides, and Greg, maybe turn it back over to you, and we can answer some questions. But again, I want to thank everybody for taking time out of your busy day. Hopefully the information was helpful, and I'll be able to hopefully answer whatever questions you might have to complete the picture for you. So thanks again.
Yeah, thanks, Dr. Kaminer, for that great presentation. Really appreciate it. For everyone on the line, we will now be responding to questions. Now, the first questions come in. So, Dr. Kaminer, first question is, would the clinical endpoint of the skin frosting, erythema, etc., be the same for the Enlighten compared to other 6 nanosecond machines?
I think the answer is yes, based on, and again, we have not had the device very long because it's relatively new to the industry. So with the experience we've had using the device, it looks like it is the same. And in the patient that I showed you, I was able to use some of the same parameters that I look for when treating a tattoo in terms of energy absorption to help guide the settings. So frosting in particular, that sort of white immediate change in the skin when the laser hits the skin. You do see that with this device. And we did use it as a way to guide energy choices when treating that patient.
Great, thanks for that answer. Next question that came in has to do with, and I think you addressed it in your presentation, but the question is about FDA clearances.
Yeah, my understanding is that the FDA clearance is both for tattoos and benign pigmented lesions. But correct me if I'm wrong on that one.
Nope, absolutely correct. Okay, next question, Dr. Kaminer. How well do patients tolerate the Enlighten treatment? Do I need any external devices to assist with comfort on the device?
Well, the only external device that I would recommend is anesthesia, injectable anesthesia. I find, some of our New Englanders are relatively hardy, but it's few and far between that they can have a laser treatment for a tattoo without an injectable type of anesthesia. So I think it would be hard to treat people without that. Once you numb them up, they do fine. I didn't find that people did any different with this device as compared to the other devices we've had for years, as long as you make sure to get them at least some injectable anesthesia. I guess time will tell if others are braver about treating their patients either with topical or other tricks that you may have already come up with. There's a question I see here about using a Zimmer chiller, and we have used that. Some patients who don't want injectable anesthesia, especially ones who feel that they're epinephrine sensitive, even if you say, look, we'll take the epinephrine out, they're sort of scared of anesthesia. I've had a few people that we can do these treatments with just some form of a chiller, and they do reasonably well with it. Not great, it still hurts, but they do better than if you didn't use it.
Great, thanks. Next question, Dr. Kaminer, is can you tell us about your aftercare? Has it changed at all with the picosecond? And I guess the question is compared to the nanosecond Q-switch device.
Not really, because I think the injury that we're creating is similar. I mean, hopefully we're impacting more ink at better thermal relaxation times at better depth with this technology. But the aftercare is similar. Everybody's got their own different style. We tend to put some sort of a cool gel, whether it's actually a liquid gel or a pad type gel sheet over the area, and then bandage the patients up. But I think I would probably do things similar to what you may be doing in your own practices.
All right, 1 second here. There's a bunch of questions coming in. We're just going to find the next one to ask. Okay, next question. What is the duration that you recommend between treatments?
It's a very, very interesting question. I had the good fortune of giving a presentation on this device in Amsterdam earlier this year, and there was a very, very interesting discussion with some of our European colleagues, in particular Moshe Lapidot from Israel, about this concept of how long do you wait between treatments. I typically wait about a month between treatments at its shortest. I try not to do it before that, shorter than a month. But there's some discussion now about potentially waiting longer between treatments to allow macrophages to clear out some of the ink debris that we've created with these laser treatments. And I think it's going to be an interesting discussion to follow. There were even some people at the meeting who said they wait 6 months between treatments because they feel they get as much improvement with one treatment at 6 months as they do with 2, 3, or 4 treatments in 6 months, just by giving the body time to heal. But it's true that patients are very skeptical about that, and B, impatient, so they'd rather be doing something rather than nothing. So I think the data will come out on this a little bit, and it may be that we start to lengthen times between treatment. But for now, I think the average is probably somewhere in the 1 month to 2 months range.
Great, perfect. Thanks for that. The next question, Dr. Kaminer, is, so for a fresh or a virgin tattoo, what spot size and what pulse duration do you typically want to start with?
Well, now you're asking me hard questions. You know, I think that's what we're learning. I'm going to try and answer the question specifically, but I think what we're learning is it used to be that you wanted to get as much, the principle is you want to get as much energy as you can with the largest spot size possible. And the reason why was simple. You wanted to get as deep as you could. And the things that limited depth were your pulse, your spot size, and your wavelength. So now when you look at a tattoo, you have a lot of different things you can think about. And I don't want to make it too complicated, but we're going to need as a collective group of physicians to think about this. You need to look at color. So let's make it simple for us. Let's say it's a black tattoo. So we're using the Enlighten, we would pick 1064 nanometers. And let's say it's, you know, professionally done, so you know that there's some tattoo ink that's relatively deep. That means you're going to want to choose as large a spot size as you can that still produce a clinical effect, which would be whitening. So now you got 1064 at, let's say, 6 millimeters if you can, you know, if you can go higher, great. But you got, so 1064 at a large spot size, and then you have to start to look at the ink itself. You know, and I showed some slides that if there's a lot of very dark ink, you might want to start with the nanosecond treatment. And if there's some finer areas or slightly more gray or lighter areas, you can do picosecond. And I think those are the things to start to think about. And we're going to learn a lot, I think, about whether picosecond treats one kind of ink better than, meaning one thickness of ink better than others. But we know for a fact that large spot sizes go deeper. We know that longer wavelengths go deeper. And I think those would be my first two parameters in looking at a tattoo, in addition to color. I hope that made sense.
Yeah, it made perfect sense. Thanks for that. So the next one is about, you know, kind of anticipating where you, obviously, you don't have the experience with treating all of the tattoo colors, but are there any tattoo colors that you anticipate being more difficult than others in looking at that spectrum of different inks?
Yeah, I think it's going to be our traditional challenging colors, you know, light green, light blue. Purple is always a really, really tough color to treat. You know, it's interesting when you look at slides. There's a group of physicians that I'm part of that send each other slides of challenging tattoos, and more often than not, purple shows up on that radar. You know, I see somebody on the questions mentioned white. You know, white or beige, those are sort of no-fly zones for me because they usually have some sort of iron component that's going to turn black when it's hit with the laser. So I warn people about that. So I don't think it's going to be dramatically different. The more challenging ones are going to be the ones that were always challenging. The ones that we're going to have a better time or an easier time treating are probably oranges and reds and some colors in that spectrum.
Dr. Kaminer, next question is, are there any disposables or consumables on the handpiece?
Not that I am aware of.
Nope, definitely. There are no consumables or disposables on the handpiece, so I'll just confirm that as well. A few more questions coming in. Give us 1 second here.
You know, Greg, I see a question in here about the number of treatments that are needed. I think it's a tricky question, but it's an important one because the goal is to get better clearance faster for our patients. And what the technology is allowing us to do is treat a broader range of tattoos and to treat them in a more thoughtful way by adjusting some of the parameters. Whether being more thoughtful with a broader range of tools in the laser is going to allow us to clear the tattoos faster is a question mark. The sort of big picture answer is yes, it's likely to be able to be done. But I think a little bit of time is going to need to elapse before we know exactly how much faster. And it's going to be tricky to evaluate because there may be some physicians that are more adept at evaluating tattoos and choosing parameters in the laser that allow you to clear it faster, and others that have a harder time sort of seeing the nuances of a particular tattoo. And it may just take more treatments just because it is hard to figure out. We don't have x-ray vision to know what's underneath. I've talked to the folks at Cutera already about it would be great if we had a tool that was like a little mini ultrasound that could see through the skin and could tell you how deep the tattoo ink went and how large the largest particle was, so you could sort of dial it in to the device. You know, that may be Star Trek kind of things, but if we could get there, we'd clear them faster.
Great. Thanks for that. The next question is, I'm just going to rephrase it here a little bit so it makes sense, but can we use just Pico, or why can't we use Pico just to treat all tattoo ink? Can we use that alone to treat all the inks that you may encounter?
You know, you may be able to, but the hard part is when you look at some of these ink conglomerates and some of the data that I showed from Cutera about the study of that Black 8001, you know, that one ink had several different particle sizes. And, you know, this is all physics. There's an art form to trying to look at a tattoo and understand what it's doing. But the reality is we're simply trying to do that to then apply physics. And the physics state relatively clearly that the thermal relaxation time of a particular tattoo ink that's in part based on size is going to determine how it responds. And so smaller particles are likely to respond better to picosecond pulse durations, and larger conglomerates are more likely to respond to nanosecond pulse durations. Now, is it possible to take a picosecond pulse duration and hammer away at a large conglomerate and make it better? I imagine the answer is yes. But again, these are things that we're starting to learn, and I think it's going to be interesting to see how that plays out.
Okay, great. Next question. Theoretically, how well do you think this will treat complex benign pigmented lesions?
You know, I think it gives us more tools. We see a lot of patients who have benign lesions who have a little bit darker skin tone, or maybe they have a tan. So this gives us some flexibility in that regard. I do think that having the ability to have 2 pulse durations and 2 wavelengths in one box allows you to sort of, you know, let's say that you have somebody who it's unclear what the optimal settings are. Well, you can pick 4 different lesions and you can try a combination of pulse duration and wavelength on them and just see which one responds best and then do your treatment. So you just get a few more tools in your toolbox. So it's likely going to make us be able to get better results faster.
Great. Thanks so much, Dr. Kaminer. We'd like to thank you again for an excellent presentation and for taking the time to answer that long list of questions. Much appreciated. So for everyone on the line, this concludes today's webinar.